want you to look at this x-ray and tell me two things. Number one, what is the current diagnosis? And number two, what surgery did they have in the past? And this is a x-ray of a shoulder. I'm going to give you that as a clue. Right shoulder. And this is the AP view, and I'm going to show you this additional view. And I want you to look at the humerus, the humeral head. Look at this area right here, the glenoid. Look at the AC joint. And I'm going to slide back to my initial film. Again, collarbone or clavicle, AC joint, humerus. I want you to look in that area. Okay, now I'm going to tell you what is going on. You should be able to tell by just looking at this x-ray that this patient has had a rotator cuff repair in the past and now has a chronic massive rotator cuff tear in addition to some AC joint arthropathy. And this is what you should know that. The space between the acromion and the superior aspect of the humerus should have at least 6 millimeters of space. There should be 6 millimeters of space right here. There is barely 2 millimeters. Because of that, we know there's a chronic cuff tear. The rotator cuff, part of its job is to hold the humerus into the glenoid. And now she's gone on to develop arthritis or rotator cuff arthropathy, which is fancy pants for arthritis after you've had a massive rotator cuff tear, in addition to some AC joint arthritis that's present. And you may go, well, how do I know she had a rotator cuff repair? Well, on this image, you can see where she's had 2 rotator cuff suture anchors placed. Now you can't actually see the suture anchors, but you can see this area where it's opaque, and then there's this radiolucent area. That's indicative of hardware. And we use biocomposite or hardware that will kind of gets resorbed into the bone, but that's what it looks like on x-ray. So looking at this x-ray, when you see an elevated humeral head getting close to the acromion, more or less than 6 millimeters, you know they have a chronic cuff tear, went on to develop rotator cuff arthropathy, which is arthritis, from a prior rotator cuff repair that went on to failure.